This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center. We're in the rehab department. Now we're going to be speaking with Tiffany Fisher. She's a physical therapist, and she's going to be telling us about a relatively new technique they're using here to relieve pain. It's called dry needling. Well, thank you for taking some time to talk about dry needling today. And I guess a lot of people might be confused. Maybe they've never heard of that term before, but it's similar to acupuncture, isn't it?
Yes, it is similar.
Yeah. So tell us, what is dry needling?
Well, dry needling is actually a manual therapy technique where they use a filament needle, which I can show you right here, very small. Mm-hmm. And what it does is it actually helps decrease muscle tension and spasm. So it's very flexible. So what actually it's going to be doing is when you have the procedure done, you'll actually put the filament needle into the muscle spasm, and what it does is it deactivates the muscle spasm so that the tension goes away, the muscle can resume its normal resting state.
So why is it called dry needling?
It's called dry needling because you're just inserting the needle itself without any kind of a solution into the muscle.
Okay, and this is for people that are dealing with injuries, or who would benefit from dry needling?
Well, really, it's anybody with pain is somebody that was going to benefit from it. So anybody that is experiencing headaches, shoulder impingement, either elbow tendonitis or some golfer's elbow, low back pain, piriformis syndrome, sciatica, hamstring or quadricep strains, plantar fasciitis, and even like osteoarthritis. So really anybody that has any kind of a pain going on at this time would be beneficial for them.
Sure. And then now this is done through the rehab departments, correct?
Correct.
Correct. So how is somebody diagnosed as a candidate for this?
Well, typically I guess it would be more if they have if they have the pain syndrome, the doctor would evaluate them and determine that they want to send them to therapy. A lot of times the therapists themselves will determine if it's an effective strategy for the patient to get better. Trigger points is one of the big ones that we see. And trigger points are really muscle spasms, and there's tension in the muscle. So then what we do is by inserting the filament needle into the muscle spasm again, it deactivates the muscle, will actually increase circulation and oxygenated blood flow to the muscle so that it can heal.
How do those spasms or those trigger points form?
Well, what happens usually is it's either a repetitive injury or an acute trauma. So what will happen is the muscle itself will tense up and form a spasm, or a contracture. And what happens to the muscle itself is it actually starts forming tissues of knots within it.
Okay, so some people may need surgery for an injury at some point, but this treatment could also delay that in some cases?
Yes, actually, yeah, definitely. It can delay that, or it can actually just, if it's truly just a muscle dysfunction, it can actually help heal it with, in an adjunct to extra exercises and other stretching and strengthening techniques as well.
Yeah. Now, when we talk about acupuncture or dry needling, I think a lot of people are concerned about needles, but actually inserting the needle isn't necessarily very painful, is it?
No, it's not supposed to be a very painful procedure. It's something that is going to be very effective, so it's definitely worth whatever pain would be involved with it.
Yeah, but again, when you, and I've had some people that have gone through dry needling, I guess when you are making the correction or helping treat the symptom, there is a little pain when you find the trigger point.
Yes, and that's just like if you think about trigger points in somebody, if you have one in your neck and you push on it, it's sore there. It's very similar to that. So when they insert the needle, you're going to insert it into that sore spot, so it's going to feel a little bit tender during that process.
Yeah. I would imagine trying to find that trigger point or that spasm, there's a whole procedure to that as well.
Oh, definitely. We do that on a daily basis as therapists.
Yeah. Take us through a procedure of trying to find that spasm.
Well, first of all, we do the subjective part of evaluation. We determine, what the patient is complaining about, what their symptoms are involving, and then we go to that specific area and do some palpating techniques. And what we usually feel is kind of like a ball of tissue, and they say, "Ow, that hurts," and so right there would be the spot where we would probably do some dry needling.
Yeah. Is it a relatively new technique here for dry needling?
Yes, it is newer to us. We do have quite a few therapists that are doing it now, but more recently trained, but having very, very great outcomes with it.
I was going to say, you must be having some great success with it. People must be not necessarily enjoying the procedure, but getting some relief.
Oh, absolutely. And even therapists will refer on to one of the trained therapists that are doing dry needling with their own patients if they think it will be beneficial.
Okay. Now, Can a person at home watching diagnose themselves and say, I need dry needling, or what's the best way to find out if dry needling is right for the person?
Well, if the patient's experiencing any pain, the person can just talk with their physician and ask for a physical therapy referral, and we'll determine that if it's beneficial or not.
All right, Tiffany, thanks for taking some time with us today.
Thank you.
Dry needling is available at Aurora in both Oshkosh and Fond du Lac. Of course, if you are dealing with pain or soreness, you should always check in with your primary care provider. If you do have questions about dry needling, you can give us a call at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.